Okay, hi everybody. I'm going to get my Instagram going and we will get the Crushing Doubt Q&A started. Give me just a sec to get this going. All right. Okay, we are good to go. Welcome to Crushing Doubt's Q&A. It's Thursdays at 6 p.m. Eastern, 3 p.m. Pacific. I'm Dr. Dan Ratner. I'm here as always to talk about mind-body issues. And of course, why do I do this? Because I've had them. And in fact, what I've really come to see over time and fully believe in is that it is the human condition to have mind-body symptoms. But the reason I do this podcast and this Q&A and all the work that I do really comes from the fact that I had 8 years of chronic everyday back pain that came from a mind-body experience. Let's talk about what mind-body experiences are. They are thinking and feeling in your brain that becomes translated into your body, and it can go head to toe, thousands of different kinds of symptoms. If the body's capable of having that symptom, the mind can make that symptom happen. And I'm going to explain all about why does that happen and what do we do about it. But as I was working to get better, nothing was really helping all that much. I guess I shouldn't say that. Chiropractic work did help some, but I didn't know why. And that really bothered me. And I couldn't get answers to my questions. But as soon as I discovered the works of Dr. John Sarno, I got at least my first answers that really started to make sense of things. And I was very excited about that. It was the first time in 8 years that I actually came to believe that I could get better. I still had questions though. And as I got better, I did find that my questions and the answers to those questions were incredibly key for getting me better. So what has happened since then? Since that time, that was back in 2011 now. Well, I guess it was 2011 then. But as I started to explore things and ask the questions that even I was left with, even after reading Dr. Sarno, I found that every answer I got made me more certain. Every answer I got relaxed not only my brain, but my body, because it was changing my thinking. And that changed everything that happened down here in the body. And so that's the goal here. We're going to talk about these symptoms in relation to my column system. It got its name from when I first started working with people. I would have people divide a sheet of paper into 3 columns to organize the 3 different ways that we can think about mind-body symptoms and where do they come from and what do we do about them. So these columns identify where the symptoms come from. These columns identify what to do about it because there's certain tasks in the column. There's not that many. And I have streamlined this system more and more until I find it to be incredibly useful for everybody on an increasing basis. I was very pleased, of course, when it worked for me. This is how I got out of my symptoms, not just the back pain, but lots of other symptoms, acute and seemingly chronic. And then I found that it actually worked for other people. And as I studied it, I came to see I'm really describing the human condition from a different angle that opens up a lot of space to get answers and get results in this mind-body space. So let's dive right in. We're going to ask a bunch of questions. You guys are going to ask the questions. I'll provide the answers. But as always, I want you guys to keep this in mind. When I give an answer, it's just my first answer. This is all a discussion. The way you get better is a good conversation with the right person or the right people, identifying the right things to be doing and trying it out. You're going to be working on it on your own, but it's the conversation with me or with other people, and even the conversation that goes on in your mind that's going to determine how you get better, when you get better, how fast you get better. So we're going to dive in with that soon, but I'm going to say hi to a couple people first. All right. Dorisa, good to see you here. She says, hi, Dan and Crushing Out community. Let me enlarge my screen a little bit, actually. Perfect. Thanks for joining us here, Dorisa. Okay, Beatrice, good to see you. Warren Henson says, hi, everyone. Warren, good to see you. Lynn Slavensky says, hi, Dan and group. Great to see you, Lynn. Let's make her, she made a reference to group, so I'm going to talk about that. On my website, which is www.crushingdoubt.com, which is not to be confused with www.crushingdoubtbook.com, which is where you can buy my book. You can also buy my book on Amazon. But if you buy it on my website, you can get a discount off of my seminar. So there's all kinds of resources on my website. And included in that is the groups that Lynn is referring to. She's in my group membership. And that is somewhat similar to the Q&A, but it's got a lot of advantages to it. It is a Zoom call private with me. And not only do I answer questions, but there's a lot more give and take in just one sitting. So you'll ask a question, I'll ask a question, you'll ask a question back until we're really honed in on the idea. And the whole idea is that we get places much further. Now, in addition, it's a very supportive place. It makes people feel safe. It's a really great setup. I love, love, love the groups. And you can check those out on my website. We are in the process of changing how we do groups, and that's going to be set up in June. So if you have questions about it, maybe you want to just email me for now, dan@crushingdoubt.com. And you can find out about these membership groups. You can find out about my teaching seminars. You can find out more about the book or really just anything about my system. So let me know. Thank you, Lynn, for saying that. Okay. Laura says, hi, Dan. Good to see you, Laura. Susan says, hi, Dan, and our Crushing Doubt family. I love that feeling. We've got a lot of closeness going on in there. Debbie A says, hi, Dan. I think you might be here from England, so you're up late, and I appreciate you being here with us. But even if you're not up late and you're not from England, I appreciate you being here with us. Okay, let's see. Anybody else saying hi? All right, we've got lots of questions to get to. I'll get to that in a second. Let me say hi to some people on Instagram, then we'll get going. Okay, Rita, thank you for joining us here. Rita's a great mind-body coach in the field who is trained in my system. I do trainings as well. So if people are interested in that, let me know. Amir, good to see you, my friend. Rita says, hi, Dan and Crushing Doubt Posse. We got lots of good names going. All right, M. Sunday, thank you for joining us here. Andrea Yee, thank you for joining us. Among the Wolves. Oh, Nick Malik, one of my this is one of my friends from my basketball league. Good to see you here, Nick. I'm excited to have you here. Introduce you to my work if you don't know it already. I love mind body work. Thank you for joining us here, Chanel. Tom EKK, thank you for joining us, and Laura Brown, thank you for joining us as well. All right, let's get to these questions because that's what you're here for. We've got to get you answers to get you the relief that you need. If you change what's happening up here, it changes what goes down in the body. Darlene, thank you for joining us here as well. Okay, Shelby Geyer says, pre-thought of questions. What an exciting life. So if you can get to them all, I understand. All right, so Shelby, I'm just scrolling down to see. Okay, good, you did post them. I will get to those shortly. Up next is Laura. All right. I'm doubting that my situation is mind-body because in the past, I've always been able, within a year or less, to get rid of other mind-body symptoms, but it's been 9 years of chronic back/shoulder itching. Okay. Oh, and then you said, and now getting worse. All right, you got a few more notes on here, so I'm going to follow them through, and then I'll answer your questions. Had a few tests done. They were fine, but my insurance won't pay for MRI, so that makes my doubt higher. I just keep holding on to the fact that when the chronic itching started, I never injured it. I had a lot of emotional trauma. Just confused why in those 9 years I've been able to get rid of other symptoms from emotional trauma, but not this one. Plus the chronic itching, I never gave it much attention until 6 months ago. It got worse from another emotional event. Okay, now this is an example of why the groups are so useful because I have questions for you, Laura. I'm going to ask them anyway, and then we can follow up as needed. But I wanted to be clear on what you're saying because it sounded like you've had the itching all this time, but you really didn't pay that much attention to it until about 6 months ago. And at the same time, I wondered, well, when you said, let's go back to this, 9 years of chronic back/shoulder itching, is the itching the only symptom that has lasted that long? And when I say that, I'm not being dismissive of the symptom. 9 years of anything that's uncomfortable is 9 years too many. But the question is, are you having other pain? Are you having other symptoms that are not resolved? Is there a cluster of symptoms that aren't getting resolved? What I'm going to do is I'm going to go with an assumption, which sometimes can be wrong. In the group, I would get to clear this up right away. But I'm going to answer your question as if I know, because that's the best I'll be able to do in this Q&A for now. And then you'll follow up if I get it wrong. So my apologies if I do. I'm going to go on the assumption from what you wrote that it's only the itching and it hasn't gone away, but it's been within the last 6 months that you've really started to think about, wait a minute, what is this? Why is this not going away like my other mind-body issues? And the real question at hand, as you've outlined very beautifully, Laura, is why did the other symptoms go away when this did not? Okay, let me break open how I would think about this. In my column system, there are 3 reasons that people have mind-body symptoms. These columns, they're called emotions, doubt, and power. The emotions column is just what it sounds like. It's about feelings. But what it doesn't just automatically just sound like is that is for the onset and uptick in symptoms. So 9 years ago, Laura, I would guess that you had an emotions column onset and uptick. Something went on right then that got that going. But that's not what carries you through for 9 years. If you have it for a really long time, we're talking about doubt. So the reason, and I'm purely speculating right now because I don't know enough. It's not really speculation because it does fit with my system and I know where this goes. But based on the way you're presenting, this has to be doubt. Anything that lasts 9 years, that's doubt. So let's talk about what doubt is. Doubt is a thought process that we get stuck in, and it can come in 4 different forms. There's fear, confusion, lack of certainty, and unanswered questions. And Laura, you can vary at different points, different moments, because we're moment to moment beings. It's always changing. And you could be fearful at one point. You could have your fear down, but just have some unanswered questions and be like, I just don't get it. But any of that, if it's not answered, leaves doubt. At the very least, you've got an unanswered question. You're asking, why is this different? And until you have a really good answer to that, it becomes very hard to settle these symptoms. Now, I will say this. Different things work for different people. There are some people where just being indifferent to the symptom would be enough. They wouldn't think about it that much anymore, and it would just drift off. Now, don't feel like a failure if that's not you. And Laura, I know that's not you. It's not how I would work either. Different people need different things. Some people will get relief by diving into the emotional work. Maybe they'll do journaling and they'll really explore what's going on underneath and say, oh, now I see what was going on 9 years ago. Now I get why it's here. And that certainty can alleviate the symptoms. But whatever you're doing, the goal, as I see it, for symptoms that last that long is to become certain about why, to figure out why is this here. So I don't have the full answer yet, Laura, because I would need to learn more about it, but I can guarantee you it's doubt. There's something that is either making you afraid, confused, uncertain, or just you've got questions about it. So that alone can make the symptom linger. And here's an interesting thing. Interesting may not be the right word because it really sucks to go through it. But when you have a symptom and it's lingering, it starts to build on its own. It's like it builds up its own lore. It's like I'm not conquerable like other things. And what needs to happen, Laura, is that belief needs to be challenged. Somehow this symptom got through in a way that you now and have come to believe that it's not going to go anywhere. And I get why you think that. It's been there for 9 years when other symptoms have not. But if we go back and we challenge that, we can get rid of this symptom too. Now, that's just my first answer, and there's a lot of specifics involved. But let's go with that. As I said, again, in group, I'd be able to ask questions about it. I'd know much more, and my answers would be much more precise. But Laura, let's go from there and see what you think about the idea that the other symptoms didn't inspire this doubt for whatever reason. I will give you one other potential pointer because there's these 3 columns. The emotions column is not why this symptom is lingering, but doubt is the primary reason. But there also could be a communication that the body is trying to share with you, and that would be a power column issue. So we can look in all 3 columns and see what's happening at any given moment, and that's going to reveal why is this symptom behaving differently than the other ones. This is a rule of thumb for you all. You make sense and your symptoms make sense. Every single time, it's going to make sense. There's nothing random. It could seem that way, but that's not the way it is. And the columns system allows you to investigate that. All right, Laura, let me know how that answer was for you, and we'll go from there. Actually, Anush, I'm going to get to you in a second. I want to say hi to a couple other people. Scotty Styles, good to see you here. Thanks for the emojis. Hilarina 10, thank you for joining us here. And Adam in Sussex, thank you for joining us as well. Okay, back to you, Anush. Hi, Dan. Having flu and sore throat, so sorry to hear that. When I have fever and all, then all TMS issues vanish. Okay, now TMS, let's talk about what that is. That's tension myositis syndrome. That's the abbreviation that Dr. Sarno, the guy who wrote the books, who really got me better, though I did have to investigate more afterwards. I didn't get a total book cure. Dr. Sarno called it TMS, tension myositis syndrome. That's what he was describing as muscular tension, primarily back pain when he first discovered it. He came to extend that to all kinds of things in the body. He even changed the name to tension myoneural syndrome to show that it's really a link between the brain and the body. Now, Anush is pointing out, you said, is it temporary healing? he's pointing out something that I've seen again and again. It doesn't always happen, but I've seen it happen a lot, where your mind body symptoms vanish when you feel sick or you're having some other pain. Now, first of all, that's evidence that they're mind body. They disappear when something changes like that. A broken bone, you could have the flu and a broken bone, and your broken bone's not going to be fine during that flu. But it does happen with mind body. Why is that? Well, multiple reasons we could say it, but one of the overarching principles that I could give to explain it is that your body and your mind are working on something else. Your mind is working on it. It's almost like a symptom has taken precedence. You're more bothered by the flu and sore throat symptoms and more focused on it than you are on anything else. And that takes your mind to a different place. Now, what this also speaks to, Anush, is that different kinds of mind body symptoms are more susceptible to this kind of change. The kinds that are especially susceptible to this kind of change are the ones where you can't stop attending to it. I call this attentional TMS or attentional mind body issues. And actually, what I was just talking about with Laura, that's an attentional issue. It's one where you kind of just can't stop thinking about it. And when you have something like the flu, you're distracted from that. You got bigger fish to fry at that time. So is it temporary healing? I would not call it that for multiple reasons. And I mean, this is good news, Anush. First of all, you don't need to heal. People use healing a lot. And even I, especially if I let AI, title something, it'll call it healing. I like to call it recovery, not healing, because healing makes it sound like there's something wrong. Recovery is getting back to a place of normal living. It does not imply that there is something wrong. So you don't need to heal. That's one thing. Secondly, it's not changing what's happening in the body with those symptoms. So there's nothing to heal. And those symptoms are vanishing because you've got a different mindset. These are mind-body symptoms. You change your mind, it's going to change what goes on in the body. This happens very frequently, and it's a very good piece of evidence that your symptoms are mind-body. And if you can remember that, that'll help you when you get better. Now, often when people get better, the old symptoms come back in. And what you need to do then is think about this as evidence and do the work against the doubt, bring it down, and you can get rid of the symptoms. Again, just to summarize for people, the emotions column is to recognize, to get emotional awareness, to bring down acute onsets and upticks in symptoms. The doubt column is to change your thinking, to get rid of seemingly chronic symptoms. And the power column is to receive that communication, find out what your body's trying to tell you. That helps with symptom plateaus especially. But it also is just about aligning with the self. So it's really about feeling, thinking, and self-relationship. And these three columns will tell you everything that's going on. All right. Warren says, Dan, my symptoms went up after stopping weekly appointments with my longtime therapist. Is that expected or surprising? That to me, let me say it this way. I can answer that question in a general sort of way, and I can answer it for you, Warren, because I know you directly. Knowing you, it is totally expected, because anything that changes gets your doubt flowing. It starts to make you wonder, is this going to be okay? You feel in more danger when something changes. So you were kind of thinking, I think at some level, is this okay to do? Is this going to be safe? It's all about, are you feeling in danger or not when it comes to doubt? So, especially with you, Warren. So generally speaking, I might have a different answer, but for you, it's expected. What I'll say generally is it's not surprising at all anyway. When you change something big, your mind changes with it. And these are mind-body symptoms. So if you change your mind, it changes what goes on in your body. So I would say overall, I wouldn't call it expected, meaning that would definitely be the case, because it can go the other way. It could be that going to those weekly appointments was actually really bothering you, and you stepped into your power and got out of it, and that would bring the symptoms down. So it all depends on what's going on in the mind. So in general, Warren, I would say it's not, I wouldn't call it expected, but I would never call it surprising that kind of change could lead to different symptoms. Okay. Let me know if that makes sense to you. All right. Darlene says, I fell last week. I'm sorry to hear that, Darlene. And they are treating me for Parkinson's. Is this TMS? Okay. This is there's all kinds of great questions. This one has a lot of nuance. This is another one that I wish we were sitting down in group and we could talk about, so I could hear more about the details of why they're saying it's Parkinson's. What are the symptoms? So if you've got a diagnosis of Parkinson's, I'll say this: Parkinson's is an autoimmune issue that mind-body issues and emotional trauma tend to be a risk factor for developing. But Parkinson's is a medical condition as well. So it's kind of both. If it's true Parkinson's, it means it can, the mind-body situation can help generate it. It's not help, but it can cause it. It can be a part of the cause of it, especially if it's really unprocessed emotional trauma. And at the same time, mind-body symptoms can massively exacerbate the symptoms that you have within this medical condition. A lot of doctors I've talked to recently have said, and I really give them credit for this, that when they hear about my work, they're really glad to hear that we can help prevent things, but they're also very aware, at least really good doctors, that we can mitigate a lot of symptoms. So even if this was actually Parkinson's, we should be able to get a lot of symptoms under control by working in a mind-body way. My question to you, Darlene, and I want you to follow up with this, is do they actually diagnose you with Parkinson's, or are they treating you for Parkinson's in a way where they're like, we don't really know what this is, but it seems like it's acting like Parkinson's? To me, that could be an important distinction. And the severity of things, as doctors see it, can be very important in that way to determine how you think about this. I do think that you have lots of TMS, mind-body symptoms. I know that for sure. My question is, what did the medical doctors say to you about Parkinson's? All right, let's talk about that. Whatever you do, though, Darlene, no matter whether it's Parkinson's or not, the mind-body process can help you a lot with any of the symptoms. In fact, much further than people think. All right, let's talk more about it. Bana Bonita, thank you for joining us on Instagram. And Darlene, let's talk more about what you had to say about that. I am sorry you fell. I'm sorry about getting treated for Parkinson's. This would all be quite upsetting, and I certainly understand that. Again, mind-body work can help you, regardless. All right. Beatrice says, for me, the best way to reflect on important things has been while pacing. If my mind-body symptoms are so severe as to prevent walking, is my mind... hold on. I think I lost the thread here. For me, the best way to reflect on important things has been while pacing. If my mind-body symptoms are so severe as to prevent walking, is my mind trying to keep me from making decisions? Trying me from making decisions? Having my... Okay, I lost track of what you're trying to say here, but I actually get the basic gist. Let's see. Did you say more about this? Hold on one second. Here. Is my mind not feeling safe to stand on my feet? It's making my life impossible. So, yes, Beatrice, I do think that these symptoms are making you feel unsafe to stand on your own 2 feet, to take steps forward. A lot of times there is metaphor in these symptoms, but I want to distinguish when there is and when there isn't. There doesn't tend to be metaphor in it when it's like, you were shoveling snow and then your shoulder hurt. That to me is a doubt trigger. It's a plausible belief that you would have a symptom, purely physical symptom there. And that doesn't come from metaphor. But if you wake up one morning and your shoulder's hurting and you are shouldering a lot of burden, it's very metaphoric. And you did have this foot onset in a much more gradual way that came from an emotional experience. So it's going to be very metaphorical for you. And all those metaphors, about feet, they make a lot of sense. Standing on your own 2 feet. And from having talked to you also, I know that these are some of the issues that you are grappling with. So, I think one of your questions here was, since pacing is a way that you've been able to reflect on important things, is this trying to keep you from reflecting on important things? And the answer to that is 100% yes. That's what happens in the emotions column. It is a distraction. The symptoms distract us and don't allow us to think about what's going on underneath. And then if we really, really don't want to know about it, guess what happens? Doubt comes in on top of that and covers it over in the second layer, Well, Beatrice, you are flooded with doubt. And that's going on because some part of your mind does not want you to know about these things. And we're, kind of like detectives. We track the symptoms. We go as deep as we can to find out more about where they're coming from. And once we know where they're coming from, that's when we can make adjustments. And doubt is going to go kicking and screaming to that place. It's not going to want us to discover things, but we are discovering things and we're getting where we need to go. Now, you did say more later, but I'm going to get to that once I scroll down through some other questions. All right. Susan Sereno. Oh, Swoon Tattoo. Good to see you here. And Among the Wolves, thanks for joining us as well. I'll be with you in your question shortly. Susan says, Dan, when I have such bad pain when I wake up in the middle of the night, I think it's like an anxiety attack that's physical. Do you think that's possible? Doubt is strong because I'm so sleepy. What can I do at that time to overcome the doubt? All right. Well, listen, overcoming doubt is an ongoing discussion with yourself. I was just talking to somebody about this earlier today. It is a practice. You can't, even if you beat back doubt in one moment, you're still going to need to practice because doubt is always going to try to come back in at various points. You got to practice fighting the doubt. So that's the first step, Susan. But we've been doing that for long enough that we've got your doubt low enough that it's time to do the emotional work. And the emotional work happens in the emotions column and the power column. Those are the emotional columns. The emotions column is where we discover the awareness, and the power column is where we figure out how we need to make adjustments. So the flow of the system is bring down the doubt, learn about the emotions, and everything flows towards power. And Susan, what you're talking about, I would see it from a columns angle as you being on the verge of moving out of doubt column as your primary work and moving into the emotions column as your primary work right now. We've talked about this before, so that won't surprise you. But you're asking, what can I do about it? Well, here's the thing. The more convinced I can get you that this is emotions column, these are onsets and upticks, screaming emotions. We've worked through the doubt. That sets you up to be able to look at it. Then what you would be able to do is to think about this in emotions column terms. What's happening instead, and I don't mean this as a criticism, I just mean it to outline what's happening. What's happening instead is you're continuing to operate in the doubt column. You're thinking about, what is this? I can't be certain about this. And ultimately, we have to get you convinced that the doubt column isn't the place to work at this moment. We are moment-to-moment beings, and the columns help you navigate moments. There are 3 different columns. Thankfully, there's only 3. And that's just the way the human condition is, as I looked at it. And at any moment, you're going to be able to analyze, what's the issue here? And I mean this is good news, encouraging news. I have never heard you say, not even once, that you woke up with pain and you immediately thought, what's going on in the emotions column, and started looking there. That never happens, not yet. You still go straight to doubt. You wonder, is this it? Will I know what to do? And I'm not saying any of that critically, Susan. I'm saying it energetically in the direction of, what can you do? You can remind yourself, this is emotions column. I've got to stop thinking about doubt. That's not going to get me an answer here. Your doubt's already low enough that you can do this. Now it's time to look at the emotions. So, you asked, is it possible that this is an anxiety attack that's physical? Yeah, that's exactly what it is. This is a physical manifestation of, I wouldn't even say it's necessarily anxiety, but an anxiety attack manifested physically makes a lot of sense to me in what you're saying. What I would say is it's an emotional attack that's physical. The anxiety is probably actually covering over what the actual emotion is underneath, some kind of anger, some kind of sadness, etc. Okay, so let's look for it. But the number one thing you can do is stop thinking about doubt, start thinking about the emotions in this situation. All right. Jana MSK, thank you for joining us on Instagram as well. All right. Among the Wolves have been experiencing skin issues for the past 6 years after an extremely stressful event. Sorry to hear that. I've understood it to be TMS or mind-body issues because it disappears in situations. Anger is an issue. How to resolve? Okay, then there's some follow-up. The anger feels like it will destroy my relationship with my parent. So I'm wondering, is it about finding a way to express this without it disrupting everything? That's another fear. You're already doing great work here. among the wolves when you're thinking about this, because you're outlining why this feels like a danger. How do you resolve this? How do you let the anger in when it could destroy your relationship with your parent? I have very good news for you, though we'll have to talk about it until it feels like good news to you and feels right to you. To me, this relates to the emotions and power columns, the emotional columns. In the emotions column, we just need to discover what the emotion is. We don't need to do anything about it. It's not going to disrupt anything at all necessarily, but it is scary to let it in because we're afraid it will. And the answer to that lies in the power column. The power column is where we decide what we're going to do about these emotions. And you're already talking about that essentially, because you're saying, if I discover this, if I let this in, what's it going to do? It's too dangerous. Well, the power column is a place where we look at the story of our suffering, our core suffering self, as I call it. And it's through this method I call the core narrative, where we like retell our story, get a really clear sense of what happened to us, and we process that. We mourn the losses. And that's something we do within ourselves. We don't even need to do it with the other people. We can eventually, potentially, but you don't have to. So I want to encourage you, there's a safe space just within yourself, especially if we're doing power column work and you're getting the guidance you need to do that work and be able to look at these things, mourn those losses, feel that. And by doing that and really sitting with it, we can actually move it into the past and move past it. Now, one thing I can guarantee you is that you can do this and you can do it without ruining your relationship. 100%. However, I do think you may need some guidance about that, and I can be of help with that. One of the main ways I can be of help is through my book. So it's available on Amazon. It's also available on my website, as you can see. On my website, it opens up the possibility for seminars, my teaching seminars, which teach all about mind-body issues and the mind-body world. Why does this mind-body person say this? And why does this mind-body person say this? We need to make sense of it all, or else we're continuing to not be sure. So those seminars you can get a discount for on my website, or you can get it at Amazon. But why am I talking about my book? Because my book is the most comprehensive. It's the most comprehensive resource that I find anywhere. It's one of the reasons I wrote the book, is I felt it was needed to have this incredibly comprehensive resource that includes the power column and how to guide about that. So I go through all three columns and what they're all about in that book. And I highly recommend it. I think it's going to shed a lot of light on how you can explore these feelings and understand them and actually resolve your anger. I went to over 20 years of therapy before I really resolved certain things in my anger. And those were the basis of the power column, is kind of finding ways to be at peace about it. This might be hard to explain without getting into greater details, but the basic gist is this. In therapy, we often try to get to peace about things. But the real problem is that we're not looking deeply enough at what actually happened. We're not processing just how bad it was. And as bad as that may sound, I think it's really going to help you. And so I'd check out the book, but also I'm available as a resource, including running my groups. I found it to be very important that there be an ongoing way that people could access me. Everything I do are the things that I wish I had when I was trying to get better. And so you're not alone. I can get you help. You can come see me. You can come see people I've trained. If you want to meet with people individually, you can come to my groups. You can read my book. You can take the seminars, and you can also keep coming here and asking questions. So there's lots of ways to do this, but you can do this. She said, thank you. It is my pleasure. I hope that was helpful for you. All right. Maria Llewellyn, thank you for joining us here. And Steph T, thank you for joining us as well. Another question from Among the Wolves is one-on-one consults with you. I do short-term consultations. There often can be a wait list. They're pretty pricey because of the demand and also because of the effectiveness. And, because when you consult with me, you're not just getting the consultation hour. You're also getting like a full assessment of your columns and an understanding of what's going on with them. But I do them. So feel free to reach out to me, dan@crushingdoubt.com. Okay. All right, back over to questions on YouTube. And by the way, if I've missed a question, just please ask it again. I'm going to kind of go through a speed round, though, and see if I can get through things because we have not too much time left. Okay. The knowledgeable mind-body doctors that I've talked to in the past haven't replied to my new symptoms, and it's making me super anxious. How to trust it's still only mind-body? Does neuroplastic symptoms pretty much control everything? Oh, the nervous system. Sorry. Does the nervous system pretty much control everything? Yeah, it pretty much does. I mean, look, if you run into a brick wall, that's going to hurt in a more purely physical way. If you break your arm, that's also true for like major medical conditions. Not yours, Shelby. I'm not talking about you. I'm not. But there are things that do need to be treated medically. Here's the thing, Shelby. This is a huge tip off, and hopefully it'll help you. These doctors have talked to you for a while. If they were concerned about you, they would be getting back to you even faster. The fact that they're not getting back to you actually is a sign that there's nothing to worry about. They would get back to you if they were like, oh my God, that sounds like something serious. And I'm not saying your symptoms aren't serious. Not to diminish them, but they're not getting back to you in part because they're actually not worried. And these are doctors that know you well. They know what's going on. They're so convinced you have a mind-body issue that they don't even really need to think about it anymore. And I mean that as good news. I'm the same way with you, actually, in that I'll get back to you, of course. But the reality is I have no doubt about what you have. Now, the question is, what about you? It doesn't matter what I think, though it's good input. It matters what you think, as you know. Shelby then says, last year when school got out, I felt I almost healed for like a month. That tells you can do it. I mean, there's no way that you've got MS or anything else if you could get to that point. My kids got out today and I feel so much pressure. I hate pressure. Like I won't be able to keep up. Last year when school got out, I felt, oh, that was the same thing. My kids. Okay. Well, let's see. Did you say more? No, that's the same thing. Okay. So, ultimately, Shelby, we've got to keep hammering away at this, and you've got to remember your wins. You had gotten this better for almost a month. You've had periods where it's gone down. Medical conditions don't behave that way. Mind-body conditions behave that way. Okay? We already answered that. Okay. Laura has follow-up to the itching question. Follow-up. Yes, terrible itching now after a traumatic event 6 months ago. It started burning, pinching pain. Okay. So, all right. This actually helps answer. This is one of the reasons why I was saying groups can be so helpful, is that we would have been able to get this answer right away. But thankfully, we're doing it anyway. What you're telling me, Laura, to me is this symptom is going to behave differently because it not only has mind-body issues embedded in it and as its main way of functioning with you, but it circles around a traumatic event. When there are really, really traumatic events, that's part of the recipe for something that I call a neuroplastic feedback loop, where the symptoms get more deeply entrenched. They're totally resolvable. It's no different, but it does tend to lead to symptoms that are seemingly more chronic. And what I would want to do is process that event with you, but also bring down the doubt. The system is bring down the doubt, learn about the emotions, flow into power. So first I would talk with you about neuroplastic feedback loops, why this traumatic event would have led to that, why this symptom's behaving differently, so that you can totally understand it. That will bring down your doubt. Then we can start learning about the emotions and see, actually, it's not always the same. I'm sure it's not. If it is always the same, that's just because doubt's super high. But once doubt comes down, you're going to be able to see some differences, and then we'll be able to track the emotions and learn from them. And that will all help us explore, well, what's going on in your power column, your relationship with yourself. That's where we'll process the trauma. Once that happens, it's all going to start to smooth out. So those are the answers. Oh, Laura actually said more about this. I'm sorry. I live with a narcissistic husband. So 9 years ago when itching started, I had horrible trauma with him. Got it. Symptoms settle down on some days, and other days they're not so pleasant. I guess the fluctuation of symptoms are due to emotions column. Yep. And doubt column. Yes, exactly. When your doubt is lower and the emotions column is raised, you're going to be able to see those symptoms more. But when the emotions column is down, it makes everything easier. It makes it easier to see things when they're up, and it makes it easier to relax and not have symptoms when they're down. So I think ultimately, yeah, we want to explore what's going on emotionally. If your doubt is low enough that this is a mind-body symptom, it's behaving the same, but it just is a higher level of trauma activation. Okay, Kasim says, hi, Dan. How do I stop rushing to get treatment when I have a doubt trigger, like carrying heavy groceries that trigger my back pain, or stepping off a sidewalk that triggers the ankle pain? Well, listen, I've got a short and a long-term answer for that, Kazim. The long-term answer is this is never going to be a problem for you, because over time we're going to continue to work at it until you will be so certain that you wouldn't even think to. I don't even like if I lifted heavy groceries and then got back pain. I'm not saying this to brag, Kasim. I'm saying it as encouragingly about where you're going to get to. I'm so certain of this stuff that I wouldn't even think to go visit a doctor about it. It would be like going to an auto mechanic when I need to buy carrots. It like doesn't even compute to me anymore. The long-term answer is we're going to get you there. We're going to get you to such full belief you wouldn't even think about it. In the short term, we need to work on that belief. We need to remember all of the things that you already know, the various symptoms that you've managed. Remember the emotions column successes that you've had, where you got in touch with something and you brought it down, or the doubt triggers that you've worked through that were just long-standing triggers. This is like another form of that. What do you do with a doubt trigger that happened right there in the moment with a very convincing physical issue? Well, we need a system for that as well. What I'd be saying to myself is, I'm not buying it. I've had enough doubt. You always messing with me, and here it is again. This actually reminds me of what I said to Susan. I'd go straight to the emotions column. I'd be like, no, this is an emotions column experience, even if it's coming through a doubt trigger. Doubt triggers can happen when you just are doing something in the environment and then something happens that scares you. But more typically, they relate to an emotion that was looking for a doubt trigger to be convincing. And that's what I'd be focusing on. All right. That's the short-term answer, Kasim. All right. Let's see if I can get through some more questions here. Darlene said, after I fell, my movement symptoms got so bad I have to use a walker. Doc has me on low-dose med to see if my symptoms subside slightly. 20%, he said. It helps a bit after I take it sometimes. I'm terrified, and sister is taking care of me, but she can't forever. Okay, Darlene, I don't know for sure, but it's sounding to me like the doctors are not saying anything definitive about Parkinson's. It sounds like they're trying to describe what they're seeing, and that's coming out as Parkinson's. Now, I would suggest maybe we get you in touch with a mind-body doctor. The mind-body doctors in the field are fantastic for this. I'm not a medical doctor, and they're the ones who will be able to tease out that. But it is sounding to me like this is mind-body. And mind-body symptoms can be incredibly convincing, and they can be incredibly dominant, actually. So you can have tremors and movement problems and trouble with speech and all kinds of things that look exactly like actual Parkinson's and aren't. And that would actually be my bet, but I can't know for sure. I think we need to get it checked out. What I would say again is, even if it is Parkinson's, still mind-body work is going to be the key to mastering almost all of it. So try, if you can, to take comfort in the fact that no matter what's happening, mind-body work can help you. But let's talk about how to get the information and get that ruled out. All right. Rudy, good to see you here. Pain Detective, he calls me. That's his nickname for me, which I love. Sherlock Holmes was a hero, one of my first childhood heroes. I've been seeing a lot of people posting about Lyme disease. Would you consider that part of the mind-body connection too? I've also been seeing about the long COVID. Is I considered mind-body too? Sorry for the mistype. Okay, I got kicked off. Did you get my messages from before? I don't know. Those are the only messages that I got, Rudy. So let me know if I've missed any. I'm going to answer what you said, and we'll go from there. So many good medical doctors consider there to not be such a thing as chronic Lyme disease. Lyme disease is an acute thing. It can be real when you get that tick bite and, it goes in that direction. But according to most doctors that I know, chronic Lyme disease does not actually even exist. And I will also say that it is exactly the kind of thing that mirrors mind-body experience. Long COVID too. It's my personal belief that those things are always mind-body. So, let's go from there. This is a discussion. I'm not ending any discussion. That's just what I know. And it's what I've experienced. And I've actually worked with people who have supposedly had both and just gotten them completely better, which, by the way, the proof is in the pudding. If I can get them better using mind-body methods, sounds like a mind-body issue. Okay, Darlene says, thank you, Dan. It is my pleasure. Let's see. Karen Isaacs, good to see you here. I get scared when my husband doesn't embrace this This, I think, meaning mind body thinking, because I get scared his leg pains will take over. I talk about it. I don't. I can't not tell him, especially because I know a part of him knows this. Yep. So this is a very common theme for many people about their significant others when they don't believe it as much as we do, which is usually the case. How do you live with a person like that? And I'm not saying that it's bad to. It's very typical to have this experience. But Karen, what I would say is, in the power column, we can get you to a place where you'd love for him to know it, but you're going to know it so strongly within you that you're not even going to care that much. And what's going to be interesting is the more you're in your power, the more he will end up wanting to listen to you about it. It's amazing. Like when I really, really wasn't in my power and really needed people to listen to me, they wouldn't. But when I don't really care because I already know what I know, suddenly everybody's ready to listen to me. All right. A couple more questions. Okay. Rudy says, yes, those were my questions. Thanks. My pleasure, Rudy. Thank you for being here. Beatrice says, I actually know that the urgency to make an important decision regarding leaving my life here to recover from serious decline versus staying here and potentially getting worse because of solitude. Okay. So ambivalent. I am apparently willing to stay stuck. Even writing about this causes new symptoms. Interesting. Aha. Look at that piece of information. And this is for everybody. Just writing about it is giving her new symptoms. That's a mind-body symptom for sure. The only thing that's changing is your mind. So that's good. And Beatrice, this reminds me of what I was talking about with Susan. Your doubt's still super high right now. And that's partly because it's a neuroplastic feedback loop. That tends to breed more doubt. And the reality is, all you need to do is the same, but it is harder when you're having very persistent symptoms. The good news is it doesn't matter. It's the same thing. Got to bring down the doubt, and that flows towards being able to see the emotional world. The fact that you're able to see that writing about this causes new symptoms, that you might not have been able to discover that before when your doubt was high. All right. Now you're starting to discover these things. And by the way, the columns work together. So this is going to be a case where the emotions column is going to give you new information. You're going to be able to see, look at this happening. And that's going to bring down your doubt. I know you're going to have doubts about that, but it's true. All right. Hillel, good to see you. I used to think that standing, for example, was just about doubt, that I just needed to understand it's not right to practice standing, and that would be it. I'd be done. But I'm slowly learning that it doesn't work that way because my stimulus threshold is very low, and because there are so many conditioned associations, I can't just erase the conditioning around standing and expect everything else to stay the same. The focus has to be on gradually lowering the overall stimulus threshold. And that's extremely frustrating and discouraging for me. Oh, interesting. I have a different way of thinking about that. You said extremely. Now, Hillel then said, you can't, for example, erase the conditioning around standing and expect all other conditionings to stay the same. It doesn't make sense. And in reality, it just doesn't work that way, unfortunately. The way forward is an overall improvement of the stimulus threshold, gradually, little by little, with a broad perspective, but it really discourages me. It feels like an endless path. Okay, I'm going to give a short answer, Hillel, and then we'll have to have a longer answer here. I don't agree with what's being said there in a particular way. It's not that I don't agree with it at all, because I think there are a lot of conditioned responses, and it might be getting there gradually, little by little, is one way to help you. But it's just one way to help you. It's not the only way. And it's also, I think you're taking a truth that seems to be embedded in that idea, and doubt is using it against you to make it sound like it's really scary. Like the fact that you can get better little by little, doubt then turns into, well, that means it's going to take forever and I'm really fragile. That's not true. That's doubt's bullshit right there. It wants to say, oh, well, if getting better little by little is the way to go, then you're really fragile. False. That is a false assumption. Getting better little by little is one way to get past it because it doesn't spike your doubt. It does not mean you're fragile, and it also doesn't mean you have to get better little by little. Listen, and not to disrupt any of the work that you're doing elsewhere, but you don't need this to be little by little. If you believed this as fully as I do, you could just get up right now and stand and do whatever you want. And I know you're not there yet, but doubt has attacked you in a way. It's getting you discouraged. Discouragement is a form of doubt. And it's doing it by it latched onto a particular idea and then started using that against you. It's not true. You can get better little by little. working on the conditioned responses and getting more comfortable with them, but it doesn't mean you have to. Okay? Much more to talk about there, but we'll get to that. Let's see. Laura said, I feel stuck in this narcissistic relationship and I feel trapped. Is this why I've had this symptom for so long and getting worse? This is power column, bingo, probably, but now lots of doubt too, since it's turned into pain. I don't mean this dismissively, Laura. I mean it to be encouraging. It does not matter what the symptom is. It matters why the symptoms are happening. And this sounds like a power column longing to communicate, to align with the self. And here's the good news. You don't have to get out of the relationship to align with yourself. You can. I'm not saying to stay in it, and I'm also not saying to leave, but I'm saying you can get peace with yourself anyway. I'm not doing these full justice because we're getting to the point where I've got to answer these quickly, but that's along the lines of what I would say. Beatrice says both feet, everything is always bilateral. Okay, well, bilateral or not doesn't really matter. What I would say to you, Beatrice, is you're in a process of symptoms spreading, and there are two sides of your body. So if it's spreading everywhere, it's going to go to both sides of your body. When I say spreading, I don't want that to worry anybody. That's what happens when doubt is unchecked. I'm not saying that critically, Beatrice. It's just you're in a big doubting spiral that's slowing down, but hasn't slowed down enough. Okay, hypermobile Ehlers-Danlos syndrome. Sorry if it's been answered before. Is this mind-body? Yes, it is. In fact, I was at the PPDA, and now ATNS is what they call themselves, the conference, and there was a whole presentation on hypermobility and EDS. Georgie Oldfield, who is a physiotherapist in England, gave a presentation on it. She said, absolutely, yes. I want to talk more about it, but that's the short answer. Can cramping in legs, numbness, feet turning white, blue be mind-body? This is my new strange symptom. Absolutely. Blood flow changes, very typical. Numbness can be very typical mind-body symptom. Cramping, all of it. If the body can do it, the mind can use it. Okay, Kasim said, I was afraid if I couldn't get the symptoms down with the columns fast enough that it would ruin my weekend, so I rushed to the chiropractor. Okay, well, listen, it doesn't matter what you do. It matters what you're thinking while you do it. So you can go to the chiropractor, but think of it as this is an aid to move things along physically faster and get me right back into the mind-body work instead of I'm broken and something is wrong. It's all about what you think while you do it, Kasim. I hope that's helpful. Marley says, hi, Dan and everyone. I'm here for 15 minutes. All right, good to see you, Marley. And you put that question down probably above 15 minutes ago. So, anyways, good to see you here. All right, I'm going to answer a couple more and then we'll wrap up. Beatrice says, even when I know the suffering, I cannot process. It's so painful. I cannot give up on what I'm about to lose potentially and have lost, even as when my symptom increases dramatically. So, and then you trailed off. Okay, there's no reason to give up, Beatrice. There really isn't. I mean, I know this is hard. I know this is a big battle, but the columns, I find them to be such a comfort in many ways, but one of them is they really actually basically always work. When I say basically, the reason I say basically is because there's only one way they don't. And that is if doubt wins. If doubt wins and you wander off into the world just continuing to doubt, then the columns may not work. Otherwise, they work. They work like a charm. And they're going to work with you also. Just keep fighting at it. Keep talking to me about it. And you're going to start to see certain progress. We could even say today, you being able to see that emotional experience when you wrote something, that actually is progress. I'm not saying it's woohoo, that's all the progress you want. Of course not. But it is getting in that direction. All right. I guess I fear last summer, Shelby says, because it was so long ago and scared something has come about, especially with all my fear and fight or flight. You're the same person you were then. You know, the chances that you didn't have something all that, you know, a year ago and all that time ago, and now you suddenly do, like, that's really interesting because doubt's so tricky, but it really doesn't make a whole lot of sense. You're saying, oh, okay, well, maybe I had a mind-body issue, but now I've developed something real because there's like lurking stuff with fear and fight or flight. I've told you many times, and I mean, this is good news. If you're processing it consciously, you are much more protected from it. All right. Teresa said, your response to Laura helped under why I'm having an uptick today. It's about embedded trauma. Bingo. Okay, I'm glad that helped, Teresa. Karen says, I loved your answer to my question. Glad to hear it. Lena Ferris says, hi, Dan. Nice to see you. Lena, good to see you. Let's talk as needed. Scotty Styles, thank you for the beautiful emojis. And Laura says, thanks, Dan, for your time and answering my questions. It is my pleasure. Guys, we got to wrap up here. But as always, get your questions answered and get them answered to your full satisfaction. So that means the first time around, even with me, you're probably not going to get the full answer, but hopefully you're going to get more answers. And that's what these conversations are for. All right, guys, it has been a pleasure. I'll see you same time next week at 6 p.m. Eastern, 3 p.m. Pacific. And I wish you all the best. Keep the questions coming. I'll keep the answers coming. Thanks, guys.